There has been concern about the recent spate of COVID-19-related deaths. In fact, that was what the MTF, we were very concerned about when the JFP, the Jurong Fishery Port Cluster, first broke out and then spread to different wet markets around Singapore. So that cluster now comprises more than 1,000 people, including many unvaccinated seniors. So we look at the numbers. Every day when you look at our press release, we show you the ICU numbers, which is a stock figure, the number of patients in ICU for that day. But we took a look at the flow figures. So over the last 21 days, that is 29 July to the 18th of August, we had 8 deaths, 7 of whom were unvaccinated seniors. So in hindsight, it was a correct decision to throttle back to phase 2 HA when the Jurong Fishery Port Cluster first broke up. Fortunately, we did that. Otherwise, I think there will be many more deaths. So that move, I think, saved many lives. So the positive news now, when we look at the flow numbers of ICUs, is that admissions to ICU is on the downward trend. As cases come down, more people get vaccinated, we see that admissions into ICU is coming down. So the last 21 days, altogether there were 19 admissions into ICU. So the first week, there were 9, second week, there were 7, and the third week, which is the past 1 week, there were 3. So it's coming down steadily, and let's hope we can keep that number down to a minimum as more people get vaccinated. Now let me move on to the second topic, which is vaccinations. As of 17 August, 77% of our population have completed their full regimen. 82% have received at least 1 dose. That is quite significant, which means sometime in September, we will have 82% of our population fully vaccinated. And this 82% includes the children under 12 who are not eligible. So if we just take into account of eligible persons in the denominator, almost 90% of our eligible population will be fully vaccinated, which is quite remarkable. And I really want to thank everyone for stepping forward to protect yourself, your family, as well as to protect others. And we have made significant progress in vaccinating seniors. By early September, 89% of our seniors aged 60 and above will have received 2 doses of vaccines. On this note, I'd like to thank everyone who has answered my call for more volunteers to help out with the home vaccination scheme for homebound seniors. So since 6 August, which is when I put up a Facebook post to call for volunteers, about 200 doctors and nurses have signed up with the SG Healthcare Corps. So as a result, we used to have 11 home vaccination teams. Now we can increase it to 33, 3 times. So hopefully that will bring down the waiting times significantly, and I really thank the volunteers for stepping forward. With a high vaccination rate, with a current high vaccination rate, our vaccine operation is increasingly moving to a retail mode. That means going out through the mobile teams, through the home vaccination teams. And the overall vaccination numbers have fallen to around 20,000 a day, and that is a quarter of what we used to do at the peak, which was 80,000 a day. So we will progressively consolidate the vaccination centers to fewer, reduce the number of vaccination centers, so residents, you will get your community club facilities back shortly. But we still need to keep a good number of vaccination centers operating for 3 purposes. 1, to vaccinate the rest of the population that has not been vaccinated. 2, after we have properly studied the safety and efficacy aspects, the vaccination of children below 12, which should start sometime in early 2022. And the third is to administer boosters. Now let's talk about booster shots. Israel has started administering boosters to their seniors and vulnerable persons. UK, Germany, and France have announced that they will start in September. The US CDC has just recommended booster shots after 8 months from the second dose. We will very likely have to start a booster exercise. And these countries started vaccinations earlier than us, and we therefore now have the advantage of observing them and learning from their experiences. Our expert committee, EC19V, is actively working on our booster program. The chairman is Professor Benjamin Ong, and he just briefed me, and he said there are 2 key things we need to find out and learn from the other countries that have started it before they finalize their recommendations. What are these 2 things? The first is the incidence of adverse reactions. Will it be as low as the first and second dose, or higher? And if it's higher, what are the steps that we can take to mitigate or remove the risk? That's number 1. Number 2, should we go for the same vaccine or a different vaccine? And we call it a homologous or heterologous strategy. And there is scientific basis to suggest a heterologous strategy may confer stronger protection. So the UK is implementing such a strategy, and we will be monitoring the outcome closely. And in Singapore too, we have not a small group, quite a sizable group of people who took the first shot of mRNA, found out that they are allergic to it, and therefore complete their vaccinations using Sinovac. So we too, the EC19, will be closely monitoring their immune response. But one thing which the EC19V is very clear on and will recommend is that we will proceed to administer a 3rd shot for patients who are severely immune compromised at the time of their first 2 doses. Who are they? Some examples are patients who are on cancer treatment, transplant patients, other patients on immunosuppressive therapy, and end-stage kidney disease patients on dialysis. And because of their conditions, these persons, they react much less to vaccination, even after 2 doses, meaning they cannot produce as much antibodies or activate the necessary mechanisms to fight the virus. Hence, a 3rd dose of vaccine is necessary for them. So the EC19V will be putting out their recommendations on this group shortly. And finally, let me talk about our health protocols. We have been making adjustments to them as we transit to living with COVID-19. And this is a key reason why we call this phase the preparatory stage. So what are the things we did? We started to allow fully vaccinated individuals who are exposed to the virus and issued QO, quarantine orders, to opt for home quarantine. Today, 80% of our community cases go into home quarantine and 20% in dedicated facilities. Second thing we did is we moved more infected persons who are fully vaccinated to community care facilities instead of hospitals. Today, 65% of community cases are in such community care facilities and 35% in hospitals. Both initiatives are working very well, which means our hospitals and the whole pandemic management capacity is less likely to come under severe stress. And we will now make a next crucial move in healthcare protocols. This is in consideration that over 98% of infected persons who are fully vaccinated have no symptoms or display mild symptoms. And it makes sense to step them one notch further, from community care facilities to home recovery, And it is not a new concept. Countries like Australia, Canada, UK, they have done so, and quite successfully. And we have been a lot more cautious, but now that the great majority of our people are fully vaccinated, we should also take a step in this direction. So we will implement a home recovery scheme as a pilot for a small number of households at the end of this month, August. We will put in place a robust monitoring and support system to make sure the individual stays at home and also receive adequate medical support. Family members, they are all required to be fully vaccinated and also quarantined at the same time. So if we want to live with COVID-19 as an endemic disease, this is a crucial step to take. It will further free up hospital capacity, enable our healthcare system to revert to peacetime operation, and attend to the healthcare needs of our population.